let's start with technology playing a role, and then we'll morph into AI playing a role. But um, because SUD providers have not had a lot of capital, things have been done more informally, more manually, more kind of on the fly. What's been important, and it's hard to argue against this on some levels. What's been important is the person, the client, the consumer. Let's help them. And if you don't have time for the administrative stuff or the paperwork or the documentation, it's okay because we're really here to help people, and that's what we want to do. And people have been able to get away with that for years and years and years. Corresponding to the blending of the revenue streams that I described, we just talked about a few minutes ago, there's more regulation, there's more oversight, there's more compliance, there's more need to not shrug your shoulders and say, we don't need to worry about that. And I've always believed for many, many years that you shouldn't have people, clinicians, case managers, people with lived experience, doing things that a machine can do faster and better. Uh, so I've always looked and gravitated to people like yourself who have always been into technology and understood that that those are our friends, that they're force multipliers, that if you can, yes, there's an investment involved in doing that, but it is a different investment than trying to find well-trained and to compensate staff when people don't gravitate to this industry or when there aren't enough of them or when that waxes and wanes. So let's have people on our staff and give them all the possible tools that we can and that we can afford. And let's have them do what they were trained to do and what they like to do. And let's get them away from doing the things that just burn them out and make them frustrated and don't really, at the end of the day, add value other than feeding the machine that exists of, you know, accountability and all that good stuff.